HealthWish is a series of conversations about the state of healthcare in New York City's fabulous fifth borough, Staten Island. Our goal is to raise issues, raise awareness, and raise health. Because when we raise health, we raise everyone. At Northwell, Staten Island University Hospital, we strive to address the diverse mental health needs for the community. Listen in for some great tips from the Chair of Behavioral Health, Dr. Rashi Aggarwal, and Dr. Brahim Ardolic to support positive outcomes. Give it a listen.
If you can understand what are the signs of overdose, you can actually save somebody's life.
None of us have not been touched by this at some point with our family and friends. I don't know anyone anymore who, if you were going to have a completely honest conversation with them, couldn't tell you that they had a really close friend or a family member who hasn't been directly touched by this. We all have. And yet there does retain this stigma a little bit, even though it's not as bad as it was at one point. It still exists. And the other point that I think is really important, very few people quit their first time they try to quit, right?
Yes.
And yet most people eventually do quit.
Yes. So think of it like a marathon. If today, and I'm not somebody who runs, right? So if I said, oh, I want to do a marathon, I'm going to fail, right? Knowing myself, I'll make 1 mile and I'll crash. But if I really wanted to run a marathon, I will have to do my first mile. And then maybe I'll stop running for a little while because it was too hard. But you have to keep at it. And I think people give up, or for families, it can be very hard, by the way. It's very hard to see your loved one struggle and not do well in school or their work. Sometimes what happens is that it's not that we stop loving them, but the emotions are so difficult for us that sometimes we become protective of ourselves and disengage because of that. If you only knew that most people will get sober if they continue to come back to the treatment. So one failure, and sometimes it's hard for us as doctors to learn that too.
Yep.
Because what happens is we see people who are coming in and they relapse. That's why we see them. But when you start seeing people who become sober and be part of their journey, so we need to share those stories more often.
I think it's important as we go through this to recognize that there is hope, right? And people do get through this. And I think we remember the darkest day. And if you can just keep going to get to it, you will get to the end. You just have to keep plugging away. And as much as possible, you have to keep people alive. One of my, I have Narcan in my house. I have Narcan in my office. I believe in it. I keep it there because I don't ever want to know that somebody overdosed somewhere that I was and I couldn't help them.
I'm so glad you're saying that. And you are making me realize that I don't have Narcan everywhere I'm going. I should, because if we save a life today, then there is hope that this person might get sober tomorrow. If you don't save that life, then there is no hope. I think part of the problem is that what is newsworthy is the negative. The newsworthy is the number of people that have substance use or that have died. It's not newsworthy that there are this many people who are fine.
Correct. That's exactly right. I will tell you, my recommendation on Narcan is put it somewhere that you go in every day so that you have to look at it. And then what happens is periodically, once every couple of years, you'll actually go and force yourself to look at the date to make sure it's still good.
Yes.
So I leave it in my sock drawer. It's always there.
I'm going to take your advice and be doing this myself.
And listen, do I think I'll ever use it? No. Do I hope I never use it? Yes. But I would, and maybe it's because I was an ED doc and I still, consider myself an ED doc, but the idea that there's somebody who would die in front of me that I couldn't help them would haunt me.
You're just making me think of my next campaign for opioid use. We need to make sure every doctor in our hospital has it in their house. That's our next thing to do.
Yep. So I can't sit here with a mental health professional and not ask you, give us some tips on what you can do to improve basic mental health and what's been proven to work and what can make a difference in someone's day-to-day life.
You're asking a question that I love to talk about, and we can talk about it for hours. The best way to improve mental health is really think about what brings you happiness, what will help you flourish as a human being. And when I'm talking about happiness, I'm not talking about the happiness that eating a donut will bring me, right? Happiness as in what brings me meaning in my life, that kind of happiness. There are smaller things you can do for mental health. Just First of all, being compassionate with yourself, being kind to yourself. I think most of us judge ourselves so harshly that we become the voices that are really whipping ourselves. And that's one of the core reasons for the high stress that we all have. So being compassionate to yourself, but also thinking about what brings you joy. And a lot of times what brings us joy are simple things like being out in the nature. If you're not doing it, you don't know it. But being out in the gardens, in the forests, around the trees, any natural scenery, and on this island, you can be along a waterline, right? Like it's so doing things that are both physically challenging, like any kind of physical activity, like running, walking, but also just doing it outdoors is one thing you can do. Reading, like just going into your hobbies, what brings you joy. For you, it's music, I know. For me, it's reading. So it's whatever brings you joy, making sure that you have time in your day to do those things. Then sort of thinking a little bit about going into, we focus so much on the negative in our lives, sort of focusing on the positives in our life. So, what are the positives? What are you grateful for? And this can be so many different ways to think about it. I was thinking about, I know I had to go to sleep late last night. I had to get up early. But the drive was beautiful. I loved watching the dogs play. So taking that pause to say, hey, what are the things that I really enjoy doing today? Most of the time, we're so busy going to our next destination that we don't see what's in our destination. So sort of focusing on some of those positive elements in your life are all things that can add up to help you flourish in some ways as a human being.
A couple of things you touched on I'd love to just highlight. Anything that you can do to release endorphins of some kind, right? Yeah. And that doesn't mean you have to go out and do 20 miles on a treadmill to release endorphins, right?
Yeah.
Endorphins can be a 1 mile walk. Endorphins can be stretching yourself a little bit, and you will get a good feeling about that. Other thing I would just say is, in line with what you're saying, is own it.
Yeah.
Own you. Own what makes you happy. And yeah, do I think that there's some value to some type of physical activity and the release of endorphins? Because that's just been medically shown to improve your life.
Actually, that reminds me, two things I should have mentioned, because one is meditation and mindfulness, because that does have a lot of evidence that it helps you. And if you are someone who doesn't meditate, like I am, just doing some deep breathing or counting your breaths for 1 minute is more than enough. So just starting with that, being mindful of just something we take for granted, our breaths. So practicing that has a lot of evidence. But the last thing I do want to bring up is play. And seeing that we are in a children's museum, just letting your inner child come out, or just play with your kids, or let your inner child come out and play. And that can do a lot for our mental health.
Yeah, as a perfect example, anyone who has a pet, and this is especially true if you have a dog,
yeah.
But think about how you feel after you have just spent 10 minutes doing something goofy with your dog, whether it's catch, whether it's watching them run around the yard, whether it's chasing them. You feel great.
Yeah.
What you're feeling isn't just an emotional thing, it's actually a medical thing. You've released hormones in your body that make you feel better. Like, it's a real thing. This isn't just oh, look, my dog is cute.
Yeah.
It's real. The other thing is, if you have a pet, anything you can do physically with your pet is also physically something you're doing with yourself.
Yeah. Actually, pet therapy is an actual treatment in medicine that's used to treat many illnesses, actually, not just mental health.
I can tell you, we recently had an adopt a pet thing for employees during break time at one of our hospitals. And I have never seen a response of joy. We've had all sorts of events, and this was almost hilarious how happy this made people. I will tell you honestly, I never had a pet. About a year ago, my wife and my son decided they wanted a pet. So I went along for the ride, and now, of course, that little dopey puppy has me wrapped around his little paw, and I love my time with him. So I can tell you that, yes, you can change, and you can learn, and you can also find joy in things that maybe you didn't think you would.
When you said adopt a pet thing that SIUH did, it just reminded me of why I've fallen in love with the island and with SIUH, is because I just started on October 28th. And the first thing I remember is some people in my department saying, oh, you have to come and look at our Halloween thing. And there I go into the parking lot, and there were such beautiful floats, like so imaginative and like something that took so long to make. And I was like, this is the place I want to work. This is the place I want to bring my kids. It's just, yeah.
Thank you for saying that. This is truly, it's a special place to me, and I've been in love with the place for a long time. There's so many wonderful things to connect to. And I will say, if you want to do something and you want to do something fun outdoors, pull out a map of Staten Island. There's all these little green sections that you should look up. And there's some really fun things that you can actually do outside that don't require that you are a marathon runner.
You can walk on the boardwalk, but when the boardwalk ends, which is pretty long, then there starts this green belt right along the water. It's lovely.
Yeah. So we're going to go play a little bit in the Children's Museum. We're going to go see some of the stuff. I want to thank you, Dr. Aggarwal, for being here and for sharing your insights about behavioral health. I want to thank you yet again for listening to us and listening about Staten Island. HealthWish is something that we've all been passionate about, and we hope to keep bringing you all these amazing things that are going on, both at Staten Island University Hospital and with all of our amazing partners that continue to try to make Staten Island better every day. Bye, Staten Island.
HealthWish wishes to thank our special guests, Dr. Brahim Ardolic and Dr. Rashi Aggarwal. Recorded at the Staten Island Children's Museum in Portia's Playhouse. We're very interested in your health wish. Contact us at healthwish@northwell.edu. Thanks for joining us. We hope to see you again soon.